I am split in two, and I wonder, which side of myself am I an imposter to? Which lesser part of me betrays the truer self, or is there a distant me operating separate projections? Please pay no mind to the woman behind the curtain. I wonder how many body shells of mine must walk around unoccupied from the amount of times that I have shed my skin. How many of those ghosts have approached a friend in a haunting, making them believe I'm who I used to be? When I stretch my neck towards the heavens at night, I am marveled at stars seeming to touch or connect to form illustrations of deities, only we are told each one of these stars are millions of miles torn from one another, unaware of aliens on Earth creating pictures with them. How is it I feel myself contained in one skeleton, yet a division leaves me at stars' length away? What a display that must show for everyone else, just as long as you're far back enough to see, and you'll be sure I'll place you on Earth and present myself up in the stars, but behind me is still a black hole waiting to rip me apart. I have a capacity to conjure up Canterbury tales, so aware of my receiving end, so I structure my gestures never to be ridiculed because I carefully color in, while a hunger festers in my stomach, climbs up to my throat to skew and twist all words that leave my mouth to sound appealing to your ear, leaving authenticity arbitrary. Only artificial apparitions to please an audience. I wonder, if you were to meet me today and then meet me tomorrow, would your mind separate these events in its memory, leaving as much space in between as stars that burn out and wear out and die long before anyone on Earth sees, because we still witness their glimmer? What if I told you that the woman behind this mask is already a corpse? As I search for heartbeats and future plans, try to find a pulse in a could-be, forgetting here, neglecting where I stand. Has there been enough time between the beginning of this poem and now to reintroduce myself? Would you still think that it's me? Thank you. I was first admitted into the psych ward when I was 16 years old for my depression. And during that visit, I met 3 different kinds of patients. One were those like myself. They found themselves in a crisis or emergency situation, and they needed the hospital to keep them safe. The second kind of patient were those who had some sort of disciplinary issue. Perhaps they acted out, gotten in fights, and because there was a history of mental illness, trauma, anxiety, their punishment was substituted for treatment. And so their mental illness, in their eyes, was seen as something wrong that they have done, and they rejected their treatment entirely. The third kind of patient is a little bit harder to just sum up. These are those who, perhaps their behavior becomes frightening to those around them. I remember one patient a few doors down from me, a young boy, who for hours at night would scream and scream before he went to sleep, begging voices to stop. He was diagnosed with schizophrenia. And because there was so much fear and lack of education for what he was experiencing, society kind of casted him out. And he would come to the hospital, be sedated, go back home, come to the hospital, be sedated. And it was an ongoing cycle. And what these 3 patients have in common is they have to come home and they have to ask themselves, what on earth do I do now? And where do I go from here? Maybe their parents are asking for them because this was an adolescent program. I had a hard time answering that question. In fact, after I was discharged, a few weeks later I was readmitted. And then after that, put into an all-day outpatient program. And then after that, was enrolled in a government program which had someone at my house nearly every day. There was a respite counselor, a case manager, a therapist, and a psychiatrist. Now granted, this was a time of my life I needed this kind of supervision. I needed to be heavily watched. And I know my family is tremendously grateful for these resources that were made available to them. And I don't take that for granted. However, there was a problem with my treatment. I was very aware with what the world saw when they saw borderline personality disorder. This was my diagnosis. I was so aware of how those people were treated, how they were portrayed in society, that I rejected my diagnosis completely. I didn't talk about it. I didn't share it with people, nor did I even try to embrace it for myself. I didn't try to understand it. Instead, I was encouraged to kind of shut it down, stop showing it so much. And I also knew that I could get away with things. I could get away with moving on in my life if I just didn't show the symptoms, if I didn't act out. I kind of kept a mask on. And this continued so much that when I was prescribed anti-anxiety medication, I was prescribed Xanax, I formed a habit, which turned into a dangerous addiction. And what this did for me is it didn't allow me to face my diagnosis. It didn't challenge me to take ownership of treatment. I just shut down. I was in a sleep-like state. I was a zombie. And I wasn't feeling things at all. Forget about with my mental illness. I wasn't feeling even the most normal of feelings. So how am I supposed to heal from something if I'm too numb to feel what I'm supposed to heal from? And this went on for years and progressively got worse and into college, where on February 20th, 2013, I attempted suicide. And I was stopped by a bystander. I tried to throw myself in front of a train, and someone on the platform stopped me. And immediately, I was put back in the psych ward, this time adults. And I saw the same 3 patients, just in adult faces. There were those trying to be safe, like myself. Those who were being punished because of something they've done. And those who were totally ostracized from their communities. So what I did during this time is I started to write. And eventually that gibberish turned into poetry, like the one that I just performed for you. But everything was turning back on. I was getting off the drugs. I wasn't taking anything anymore. So everything that was shut off for so long was going back. And these wires that the electricity was flowing through was frayed, and static was kind of flying everywhere. And the only way I knew how to ground that static, those jolts and shocks that I felt so severely at this time, was putting everything on paper. I wrote down everything I felt, everything I saw. And this was my way to begin dealing with my diagnosis, to begin dealing with what I never yet dealt with. So what I realized since that time is that all my efforts to be filtered, to be contained, to be held back, to keep suit and pull it off, has been keeping me from healing. Mental illness, whether it be borderline personality disorder, depression, anxiety, they're not talked about. They're not invited into our conversations. Instead, we often make the mistake, sometimes out of fear, of encouraging young people who begin showing signs of mental illness to hold back, to stop acting that way. Pipe down, calm down. Let me just say, being told to calm down when you're anxious is probably the least calming thing in the world. But it comes out of fear. It's something different, so we want to just stop it. That urgency is there. And it's become so hurtful to those who deal with it. Rather than silencing those who deal with it, kind of putting them back in the margin of what is normal, what if we gave these people a microphone to share their stories? What if instead of telling them to be quiet and turning off the voltage completely, what if we redirect that to power something new and power something innovative and great? What if instead of stigma and shame that we attach to mental illness, we provide these people with a platform? Mental illness is complex. There's not a simple answer. There's not this or the other. But when we're looking at treatment, it involves so many things. It involves community. It involves a creative aspect, the way I have found. It involves being held accountable. It involves so many facets. And when we shine a light into those darkest places within these facets, we have a true, honest chance at achieving mental health. But there's some things that must stop in order for that to happen. We must stop, as a society as a whole, those with mental illness and those without, to think that it is as simple as taking a pill, like you would an antibiotic, and getting the virus out, and then you're done. A lot of times when I share an anxious thought or something that's inside me with a friend, I've heard a lot of times, it's all in your head. Why, yes, it is all in my head. It's in my brain. It's in the way I receive information, the way I make connections in the world, the way I comprehend life. That is my brain. And science has come a long way. We're not doing lobotomies anymore, but we have a long way to go. While there are MRI scans that can map out brain activity and we can capture wavelengths, we haven't really scratched the surface on the anatomy and the neurology of mental illness. And while, yes, serotonin plays a role in something like depression, so a lot of the antidepressants that are prescribed have serotonin, that's one part of my brain that needs that chemical. And now my entire brain is saturated with that brain. What are the lifelong implications of that? I take a pill every morning that I know helps me get to school and get to work and keeps me going. But what does that do 30 years from now? How does that help me own what I experience? And how do I get past that to really achieve health? Now, I'm not suggesting at all that these pills are bad and that we should just throw them out and say to do with it. No, because I know how helpful and life-saving they have become for me and other friends. But it's not enough. It's not enough to just say, it's a pill, quick fix, your symptoms are gone because you're muted, you're better. Because that's not the case. And it concerns me that the imbalance that my brain is experiencing is not tested. There's no way to pull out fluids in my brain and test your imbalance and say, okay, this is how much you need, there's no way to do that. And it concerns me that when I go to the doctor for a sore throat and they see these medications on my chart, a stigma tells them to immediately take me less seriously. And it concerns me that if I go to a friend with an anxious thought, with my depression, I oftentimes get the response before even a word is spoken, have been taking your pills? Instead of having a conversation with me and allowing those emotions to be valid. It is unhelpful, even dangerous, to view mental illness as something that is just curable and something that you can treat symptoms that will just go away. This is really detrimental to not only those who experience mental illness, but to those trying to help. It leads us to a place where we want to shut things off instead of really moving and through understanding what it is that my mind is going through, the way my mind works. Yes, it's different from you, but that does not make it invalid. That does not make it unworthy. I don't take Xanax anymore. I do not take the drugs I use to kind of numb me out and get through things. But the emotions, the thoughts that led me to that place, they still come. I still have to deal with those. So even though I'm not acting in a certain way, right, the symptoms don't show, I'm still dealing with my mental illness because my brain is wired that way and I'm perceiving the world in a certain way that's causing me to feel and think this way. And you know what? There is power in feeling too much. There is power in seeing the world aligned with patterns, and there is power with wanting to maintain those patterns sometimes. And yes, sometimes it is so much, and it is so big, and it overwhelms me, and I feel like a threat to myself. I feel I might hurt myself because of all this. But maybe it would be less hurtful if when I went to a friend, when I tried to work out what I was feeling, I wasn't hit with the stigma. I wasn't hit with the impulse to just stop thinking like that. I think it's time, those with borderline personality disorder, OCD, anxiety, depression, bipolar, whatever it may be, that we share our stories, that we're given a platform to share. You know, I have been given a platform, and I have been able to work through the way I think, the way I feel, because of a university that embraced me, and I was able to finish my degree. And now I'm able to move on and get a second degree. I'm being embraced, and I'm getting a platform so that I can use the way I think. I can work for organizations that want to see the same change in the world and want to use my skills and talents to bring that change about. But if we don't give people a platform, if we don't allow them to think the way that they do, and we just mute them, shut them down, how is that change ever going to happen? How is that healing ever going to happen? Some of you are going to go home, and you know someone, maybe close to you, who has mental illness of some sort. Or maybe you'll meet someone a year, a few months, some weeks from now. Maybe you are that someone. If you are that someone, your thoughts are worthy, and you are worthy. If you have that someone in your life, I urge you, listen. Don't try to shut it off because it is not like you. Don't try to push it away because it's so different. Encourage them. Give them that safe space to move through this. And let's make those places in our society, let's make those spaces in our communities where that source of power is needed, that way of thinking is needed to build something new. And give those people a platform. Give them a microphone, just like I have been given today. Thank you.